Hi, my name is Jessica, and I'm doing my report on nurses who bully or mistreat patients and how it can affect the patient's care, the family members, how you can stop it. I actually am going to go over a personal issue that I had with being mistreated by a nurse when I was 6 months pregnant and I was hospitalized. So basically, there's a big issue with nurses who mistreat patients, especially with either infants or the elderly. Um, there was a case that I was reading about where there was a nurse who was trying to fight um, getting her certification taken away because she had been caught to be the one that actually broke a patient's arm, and then when something happened and they went into a cardiac arrest, she failed to help them. And this happens all the time. Like you hear it all the time how they mistreat patients in nursing homes and long-term care facilities. And most of the time, the patients that they're doing this to are the ones that can't talk or can't fend for themselves, um, that don't have family members that are coming by and checking on them. So they're just sitting there and they're suffering, you know. And it a lot of time goes under the radar, and a lot of times it's too late by the time um, the patient is either deceased or in very very critical condition before it's found out that they're even being abused. Um, and you know the other thing is there's a lot of um, sorry. The other part to it is my story. Sorry. Um, with having a nurse bully me was I was actually in and out of the hospital for about every 2 weeks I was in there when I was pregnant, and back in 2014. And I had an issue with my gallbladder and my appendix while I was pregnant. I was too far along when they found out actually what it was to have it taken out, and anybody that has had the gallbladder issues knows it is the worst pain ever. Um, so the last time I was in there, I had been diagnosed with severe pancreatitis, which is a very, very bad thing when you're pregnant at all, even at all, but when you're pregnant especially. And I was admitted to the hospital, and there was a couple medications that I was on that had been approved from all of my doctors, all my providers. Uh, I got second opinions to make sure, that it wouldn't affect me or the baby, and I was making the right decision. Until this one nurse, I had her 2 nights when I was there. You know, she didn't agree with, I guess, what I was doing. She didn't believe in the fact that I was either taking certain medications, that I was taking medications at all, the fact that with my gallbladder and being pregnant, I was basically on a chicken broth diet and clear liquid diet the entire week and a half I was in there. Um, One of the problems she had was with my antibiotic, and I couldn't help that. I had to have it to basically fight this infection that can potentially kill you. And when you're not pregnant, when you are pregnant and everything's moved around, it's even worse. And um, so she proceeded to tell me the first time I heard it in the hallway, and how could she do that to her daughter? How when she's pregnant, how could she do that? She's not thinking about the baby. She's only worried about herself. It can't be that bad. People deal with things like this when they're pregnant, and she just needs to wait. And then I didn't say anything. I was kind of in shock that this was coming from somebody who's supposed to be on my side and supposed to be helping me. They were telling me this. Um, then the next time it actually came, when I noticed it had been quite a while since I had my antibiotic and a couple other medications that I was supposed to get on a certain basis. They were supposed to give them every 4 days, 6 hours or whatever. And so I called her in and I said, I need my medication. I'm supposed to have it an hour ago and I haven't got it. And she actually told me, she said, I don't know why you're choosing to do this. You must not care about your baby. How could you do this as a mother? You're not choosing what's best for your baby. You're worried about what's best for you. Basically, everything she said in the hallway, she had said to me. Then refused to give me my medication. About an hour later, the doctor came in and saw that I hadn't taken it and asked me why. He asked if what was going on, why I wouldn't have asked for my medication or taken my medication. I said I did. I asked for it, but the nurse refused to give it to me. Now, going through all that and being released, just her being downright nasty and not doing basically what she was there to do was to help me and help me feel better and help me be comforted and time of need to take care of me and nurse me back to health, basically. Um, she, the doctor actually informed me that, not, and a lot of people might not know this. One, a nurse can never refuse you your medication. When you request your medication, you have to speak up. But if you request medication of any sort or any sort of help, they cannot deny you that. I didn't know that. So I potentially put myself at risk because I wasn't taking my antibiotic because she wouldn't give it to me, which was doctor ordered. And that infection could have grown and I could have gotten sick and she was putting me at risk. How could she do that to me and my baby? Um, and then, you always have the right to ask for a different provider, whether you're in the ER, whether you are, um, whether it's a nurse, an ER doctor, a regular physician, and a thing, you always have the right to your care, to the best care that you possibly can have. So you can ask for a new physician. You can ask for a different nurse. You can let them know what's going on. And by far, if they ever deny you, I don't care if it's antibiotics, if it's uh, acid medicines or God knows whatever else, pain medication, they cannot deny it as long as it's within the healthy spectrum and you're actually prescribed it. Um, and just speak up if you don't feel like you're being treated fairly. And a lot of people don't. A lot of people say, well, they're the nurse. If I say something, then they could potentially retaliate, or nobody's going to believe me. It's a nurse. She's there to help, and they're not going to believe me. It's going to be he said, she said. Well, it doesn't matter. I found out it does not matter. They might not get disciplined until they investigate it, but you will not be with that same nurse if you're not comfortable, because that's all it's about is you at that point, your health and your safety. And that's like the biggest thing I can stress is if you don't feel comfortable, if something like this were happening. And one of the biggest reasons why I decided to go get a different degree and go into nursing was because this happens all the time. Like I spoke earlier, if it happens with the elderly or if it happens with infants, that's the one thing I cannot understand. For some reason, there are some nurses that are just, I say they're just there for a paycheck. They're just there because it's good money. They don't have interest in helping people. They don't have interest in what's best for people. And, I don't understand why you would go into that knowing that you don't actually want to help that person and you could potentially be the reason why that person gets worse or, critical condition, their condition gets worse, or they could be afraid to go get help the next time. You never know. So that's the biggest thing I can emphasize and just conclude that, you have the right to the best health care possible. So make sure you inform yourself before, you know, anything bad happens.